ಓಹ್ ಬನ್ನಿ ಬನ್ನಿ ಗಿರೀಶ್ ಅವರೇ.
ನಮಸ್ಕಾರ ರೀ ಡಾಕ್ಟ್ರೆ.
ನಮಸ್ಕಾರ. ಹೇಗಿದ್ದೀರಾ?
ಏನಿಲ್ಲ ಡಾಕ್ಟ್ರೆ, ಬೆನ್ನು ಭಯಂಕರ ಆಗಿಬಿಟ್ಟೈತಿ. ನಡ್ಯಾಕೂ ತ್ರಾಸ ಆಗತೈತಿ. ಎರಡೂ ಕಾಲು ಬಿಗಿ ಹಿಡಿದು ಬಿಟ್ಟವು. ಯೂರಿನ್ ಮೋಷನ್ಗೆ ಹೋಗಾಕೂ ತ್ರಾಸ ಆಗಿಬಿಟ್ಟೈತಿ ರೀ. ಒಂದೊಂದು ಸರಿ ಅಂತೂ ಮಾತಾಡೋಕ್ಕೂ ಆಗಂಗಿಲ್ಲ, ಉಸಿರು ಹಿಡ್ದಂಗೆ ಆಕೈತಿ.
ಇಲ್ಲ, ಫಿಸಿಯೋಥೆರಪಿ ಸೆಷನ್ ಅಟೆಂಡ್ ಮಾಡಿಲ್ವಾ?
ಇಲ್ಲ, ಹೆಲ್ಪ್ ಆಗಲಿಲ್ಲ.
Doctor, what to do?
ಓಕೆ, ನನ್ನ ಸಜೆಷನ್ ನೀವು ಡಾಕ್ಟರ್ ಶಿವಕುಮಾರ್ ಅವ್ರನ್ನ ಮೀಟ್ ಮಾಡಿ. ಈಸ್ ಅ ನ್ಯೂರಾಲಜಿಸ್ಟ್ ಎಟ್ ದ ಸಿಟಿ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಹಾಸ್ಪಿಟಲ್. ಯಾ, ಬಿಕಾಸ್ ದೇರ್ ಸೀಮ್ಸ್ ಟು ಬಿ ಸಮ್ ನ್ಯೂರೋ ರಿಲೇಟೆಡ್ ಸ್ಪೈನಲ್ ಕಾರ್ಡ್ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್. ಅವ್ರು ಖಂಡಿತ ಹೆಲ್ಪ್ ಮಾಡ್ತಾರೆ. ನಾನು ಬರೆದು ಕೊಡ್ತೀನಿ.
Doctor, report.
ಐ ಕಾಂಟ್ ವಾಕ್ ಪ್ರಾಪರ್ಲಿ. ಡಾಕ್ಟ್ರ್ ಒಟ್ಟು ನಡ್ಯಾಕೆ ಆಗಕತ್ತೇ ಇಲ್ಲ.
ಡಾಕ್ಟ್ರ, ಫಿಸಿಯೋಥೆರಪಿನೂ ಏನು ಹೆಲ್ಪ್ ಆಗಲಿಲ್ಲ ರೀ. ಜೊತೆಗೆ ಕಾನ್ಸ್ಟಿಪೇಷನ್ ಮತ್ತು ಬೆಡ್ ವೆಟ್ಟಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಕೂಡ ಶುರುವಾಗಿತ್ತು ರೀ.
Girish, there might be a problem with your spinal cord. Let's get some tests done. Please get this MRI scan done and come back with the reports. Sister, arrange for a cervicodorsal spine MRI, both plain and contrast immediately.
Yes, doctor. ಗಿರೀಶ್ ಅವರೇ, ಪ್ಲೀಸ್ ಬನ್ನಿ.
Please see your Girish. ಪಸ್ ಅಕ್ಯುಮುಲೇಷನ್ ಆಗಿದೆ, ಕಾಣಿಸ್ತಾ? ಸ್ಪೈನ್ ಮೂಲೆನಲ್ಲಿ ಇನ್ಫೆಕ್ಷನ್ ಆಗಿ ಹೋಗ್ಬಿಟ್ಟಿದೆ. ಮತ್ತು ಇಲ್ಲಿ ನೋಡಿ ಹೇಗೆ ಬೋನ್ಸ್ ಬಂದು ಕಂಪ್ರೆಸ್ ಆಗೋಗಿದೆ. ಸ್ಪೈನಲ್ ಕಾರ್ಡ್ ಮೇಲೇನೂ ತುಂಬ ಪ್ರೆಷರ್ ಆಗಿಬಿಟ್ಟಿದೆ. ಈ ಕಂಡೀಷನ್ಗೆ ಹೆಸರು ಪಾಟ್ ಸ್ಪೈನ್ ಅಂತ ಹೇಳ್ತೀವಿ.
ಪಾಟ್ ಸ್ಪೈನ್ ಅಂದ್ರೆ
ನಿಮ್ಮ ಸ್ಪೈನಲ್ ಕಾರ್ಡ್ ಮೇಲೆ ಟಿಬಿದು ಇನ್ಫೆಕ್ಷನ್ ಆಗೋಗಿದೆ.
ಅಯ್ಯೋ ದೇವ್ರೆ, ಟಿಬಿನೋ ಡಾಕ್ಟ್ರಾ?
ನೀವು ಇಮಿಡಿಯೇಟ್ ಆಗಿ PRS ನ್ಯೂರೋ ಸೈನ್ಸಸ್ ಸೆಂಟರ್ಗೆ ಹೋಗಿ ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ಅಡ್ಮಿಟ್ ಆಗಬೇಕು. ನ್ಯೂರೋ ಸರ್ಜನ್ ಹತ್ರ ಸ್ಪೈನಲ್ ಕಾರ್ಡ್ ಪ್ರಾಬ್ಲಮ್ಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಗೊಳ್ಳಿ. ಅವ್ರ ಹೆಸರು ಡಾಕ್ಟರ್ ಶರಣ್ ಶ್ರೀನಿವಾಸನ್ ಅಂತ. ಅವ್ರ ಕಾಂಟ್ಯಾಕ್ಟ್ ಡೀಟೇಲ್ಸ್ ಬರ್ಕೊಡ್ತೀನಿ, ಅವರನ್ನು ಹೋಗಿ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿ.
But promise me that you won't tell anyone about it. Everything that happened at the conference is very confidential.
Of course I won't tell anyone. You can trust me. I completely respect Dr. Sharan and Dr. Pratibha's privacy. I just want to know what happened. So tell me.
Okay. So, the boy was 15 years old.
15? So young. What happened to him that's untreatable?
He had a very normal childhood like any other person. He went to school also.
Okay.
Then suddenly he started experiencing a pull on his backside of his neck, and it just kept growing over the months. And suddenly one day, his head and the neck just fell backward. He had no control over his head and back.
What? Is that even physically possible?
Yeah. It's like his head just went back as much that it goes forward. Somebody had to hold his head all the time. And of course, it was his mother. Even when he would go to the toilet.
That's so sad. So then what happened?
He could not walk properly, talk properly. In fact, after some time, he started developing shaking in his hands and legs.
Oh my God.
He could not even hold anything. Bottle of water, cup of coffee, nothing. He lost his balance also. And just imagine, for his parents, their life had come to a complete halt.
Must be so sad. I mean, I can't even imagine what his parents must have gone through. I mean, if something like that happens to us, what can our parents do?
They just went to all the government hospitals first, but obviously nobody had any answer. So they were referred to, senior doctors. And that's when it was established that he had a case of severe generalized dystonia. And then there was a pacemaker that was supposed to be implanted in his brain. And, it's called DBS.
Oh, yeah, Dr. Sharan did mention DBS.
But DBS is a very expensive procedure. About 15 to 17 lakhs for a procedure.
What? 15 lakhs?
Yeah.
How did they manage?
They borrowed it from their friends and family and got the operation done from Dr. M.K. Singh.
Okay.
But it didn't really work, After 2 years, the batteries ran out and there was only 30 to 40% of improvement in the patient. Replacing the battery would cost another 7 lakhs.
7 lakhs? That's insane.
Then they just went to Dr. M.K. Singh back and wanted to ask if there is a solution to this permanently that they can opt for.
ಸರ್ ಬ್ಯಾಟ್ರಿ ರಿಪ್ಲೇಸ್ ಮಾಡಬೇಕಾ? ಇಲ್ಲಿ 30-40% ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಕಾಣಿಸ್ತಾ ಇತ್ತು. ಅದು ಈಗ ಇಲ್ಲ. ಬ್ಯಾಟ್ರಿ ಡೆಡ್ ಆಗಿದೆ ಅಂತಾರೆ. ಪ್ಲೀಸ್ ನೀವು ಹೆಂಗಾದರೂ ಇವನನ್ನು ಸರಿ ಮಾಡ್ಬೇಕು ಸರ್.
Look here, sir. Unfortunately, the only option you have is to change the battery. I'm really sorry. Actually, there is another option. Why don't you go to PRS Neurosciences? There is a Dr. Sharan there, and he's possibly the only doctor who will attempt such a critical surgery.
Well, they went to Dr. Sharan, not knowing that there was a trap that Dr. M.K. Singh was trying to lay.
ನೋಡಿ, ಇದು ಸಾಧಾರಣ ಕೇಸ್ ಅಲ್ಲ. ಈ ಥರ ಕೇಸಸ್ನಲ್ಲಿ ನಾವು ಸ್ವಲ್ಪ ರಿಸ್ಕ್ ತಗೊಳ್ಬೇಕಾಗತ್ತೆ. ನಮಗೆ 10 ನಿಮಿಷ ಕೊಡ್ತೀರಾ? ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡ್ಕೊಂಡು ನಿಮಗೆ ಹೇಳ್ತೀನಿ. ಪ್ಲೀಸ್ ಆಚೆ ವೇಟ್ ಮಾಡ್ತೀರಾ?
I will operate PATs. And step 1 would be to remove the DBS battery and the electrodes from the brain.
Once removed, they can't be put back again.
Step 2 would be to do bilateral lesioning under GA.
My neuro rehab team will do a complete evaluation before both steps.
We'll have to do this on both sides, just like in DBS.
Burning both circuits at the same sitting is extremely risky, Sharan. You yourself say this.
I know, but I have a feeling that we can pull this off. ಬನ್ನಿ.
ನಮಗೆ ಇಲ್ಲಿವರೆಗೂ ಯಾವುದೇ ನಂಬಿಕೆ ಇರಲಿಲ್ಲ. ಈಗ ಸ್ವಲ್ಪ ಭರವಸೆಯ ಬೆಳಕು ಕಾಣ್ತಾ ಇದೆ. ಸರ್, ನೀವು ನಮ್ಮ ಪಾಲಿಗೆ ದೈವದ ಥರ ಬಂದಿದ್ದೀರಾ ಸರ್. ದಯವಿಟ್ಟು ನಮ್ಮ ಮಗನ ಸರಿ ಮಾಡಿ, ದಯವಿಟ್ಟು ಅವನನ್ನು ಕಾಪಾಡಿ.
ಡಾಕ್ಟರ್ ಶರಣ್ ನಿಮಗೆ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡ್ತಾರೆ.
ನೋಡಿ, I have made the decision. We will operate. And I will burn the brain on both sides. Okay? I am willing to take the risk. Are you?
ನಾವು ಯಾವುದೇ ರಿಸ್ಕ್ ತೊಗೊಳಕ್ಕೆ ರೆಡಿ ಇದ್ದೀವಿ. ನಮಗೆ ಯಾವ್ದು ಸರಿ ಯಾವ್ದು ತಪ್ಪು ಅಂತ ಗೊತ್ತಿಲ್ಲ. ನಿಮ್ಗೇನು ಸರಿ ಅನಿಸುತ್ತೋ ಅದನ್ನೇ ಮಾಡಿ ಸರ್. ಅವನ ಹಣೆ ಬರ ನಿಮ್ಮ ಕೈಯಲ್ಲಿದೆ. ಆ ದೇವರೇ ನೋಡ್ಕೋತಾನೆ.
Don't worry. Utmost care will be taken and we will do the surgery. Okay?
Are you sure about this, Sharan? Have you thought through every step?
What do you mean?
Think about it. We do the surgery under local anesthesia. And we need to fix his head in a frame, and his head is not going to stay still.
See, that is why what we'll do is we will put him under general anesthesia and then fix the frame, and afterwards we'll tone down the general anesthesia and then look for his response. Okay?
What is the cost of the surgery, doctor?
See, normally the cost of this surgery is around 5 lakhs. Okay? 2.5 lakhs on each side of the brain.
We don't have that much money left after the DBS surgery done by Dr. M.K. Singh, sir.
Okay. Let me try calling Dr. M.K. ಕೆಲವೊಂದು ಸತಿ ಇದು ಪೂರ್ ಪೇಷಂಟ್ ಫಂಡ್ಸ್ ಇರುತ್ತೆ. ಮೇ ಬಿ ವಿ ವಿಲ್ ಬಿ ಏಬಲ್ ಟು ಗೆಟ್ ಇನ್ ಟು ದ್ಯಾಟ್. ಹಲೋ ಸರ್.
Hi Sharan, tell me.
Sir, I just finished evaluating the boy that you referred to me, sir. I wanted to inquire if there are any funds left in the poor patient funds that we may utilize for his surgery.
Oh, you actually think the surgery will work, huh? Interesting. Unfortunately, we don't have any funds for the surgery. Sorry.
Okay, sir. I understand. We'll try to arrange the funds from somewhere else.
You know, actually, there is another way we can get the funds.
Yes, sir. Sir, how, sir?
Well, you know, there's this movements disorder conference coming up next week.
Yes, sir. Yes, sir.
So how about I give you a little challenge so that the surgery can be funded?
Challenge, sir. I didn't understand that, sir.
Let me lay it out for you, Sharan. I know you're planning to do a simultaneous bilateral lesioning surgery on the boy. It's probably the only way to give the kid a chance. If the pallidotomy surgery on the boy can be demonstrated in a live stream in front of everyone to watch, then I can convince the committee to bear the cost.
Sir, I think that is a wonderful idea, sir. I will be most happy to do this as a live conference surgery.
Hear me out completely. There is a big but. But the cost will only be borne if the patient shows sufficient improvement soon after the surgery. Else, you pay for the surgery yourself.
But sir, you know very well, sir, that in pallidotomy surgeries, it may take many weeks for some recovery to be shown.
Let's see if you got what you say it takes. I, Dr. M.K. Singh, challenge you, Dr. Sharan Srinivasa, to prove that your gimmicks work on real hardcore diseases.
I accept your challenge, sir. We will do this in the conference.
So Dr. Sharan accepted the challenge, even when he knew that the chances of immediate recovery are very low. So the deal was, if the surgery went well, then Dr. M.K. Singh is going to accept that lesioning is the great future and he'll fund the entire surgery. And if the surgery didn't go well, then Dr. Sharan would accept defeat and would just accept that this whole procedure is a scam and also will fund the entire surgery.
That's such a sick mentality, you know, like to use a boy's condition as an open challenge to feed his own propaganda. Not done.
But that time, Dr. M.K. just wanted to get Dr. Sharan down. He would do anything for it.
Yeah, I remember as a teenager, you know, watching this in the news, it was everywhere. And that is why I was so curious when I came here. I wanted to know about this case. And I also wanted to know why would Dr. Sharan take up this challenge? I mean, even if the surgery goes well, let's imagine, it's going to take an extensive amount of time for the boy to recover. I mean, if nothing, at least 6 months of rehab, right? Why would he take up something like this?
So, you didn't ask him this?
You think I didn't try? Of course I tried. He didn't, for the same reason that he never answers any questions on Dr. MK. He just didn't say anything. Honestly, you've just told me what the challenge was. You haven't told me what happened. Did the boy improve? Did the surgery happen?
Chalo theek hai. Suno fir. On the day of the conference,
Most of the time, improvements in a pallidotomy, especially dystonias, do not happen soon after the surgery. However, if Dr. Sharan believes and has the abilities, then he should demonstrate in front of all of us right now. Let's see what happens.
Manju, XYZ coordinates okay? Yes, sir. All right. Okay, open, close, open, close, open, close. All right, ready to go. Lesioning.
it is said that this was the most complex surgery because lesioning was being done on both sides of the brain at the same time.
Oh. So then what happened? Did it actually work?
Well, the patient didn't show any sign of improvement immediately.
Really? What went wrong?
Dr. M.K. Singh had a whole panel discussion
Okay.
where he openly condemned Dr. Sharan.
Ladies and gentlemen, I was right. once again. I think we need to put an end to these bogus surgeries here and now. They serve no purpose. It just gives poor people false hope. I think we should put an end to this scam right now.
MK, you know, it's very important. The rehab is very important after the surgery. And there are certain complex cases which can take months for recovery, which can take months. But that does not mean that the surgery has not worked. You know what you're doing sitting over here? You know what you're doing? You are insulting the integrity of the surgeon without waiting to see the full and final result.
Physiotherapy. That's what it is. You call it neuro rehab, you call it rehab. At the end of the day, what does it do? Shake a leg, shake a hand? It's absolutely of no use.
So sad. Really so sad. Neuro rehab does not mean only physiotherapy. It consists of physiotherapy, occupational therapy, memory therapy, language therapy, swallow therapy, even cognitive therapy, you know that?
And now you're giving me a lesson in medical science.
I have to. You're not getting my point. I have to.
I said, please stop this.
Look at him, the way.
Please stop this.
As long as I'm the president of this association and the dean of this institute, I will not let any unscientific and unethical things happen under my leadership. The results of this challenge, whether the surgery worked or not, will be decided 6 months later at the next CME. Please.
Yeah, it's okay. Okay with me. It's okay.
Okay. Thank you.
Thank God Dr. Surochna was there, who gave fair enough chance to the recovery. Otherwise, Dr. M.K. Singh would have condemned Dr. Sharan to be a complete failure.
My God. So what happened eventually? Did the boy recover at all?
Well, you tell me, do you think the patient recovered?
How am I supposed to know? Yeah, you tell me.
Well, can't you see?
Huh? What do you mean?
You're talking to the patient right now.
Wait, what? No. I can't believe. You are actually the boy. Oh my God. You were right in front of me all along. How did this happen? This is a miracle. You look completely fine to me.
Not really. I do have my occasional wobbles.
Really? I thought that was your style or something. Oh, but how did this miracle happen? I mean, you said the surgery didn't work.
The surgery definitely worked. It's just that the lesioning had to be understood by my body, and that happened through rehab. And PRS Neurosciences has developed an amazing software called Neurologics.
Okay.
Now, that's where all the magic happens. In fact, in the next 6 months, at the CME, the successful results were shared, and Dr. Sharan was credited for it.
Sharan was the first and only student of mine who rejected my offer to train under me as a neurologist. He wanted to be a neurosurgeon, which I always thought he would regret later. But today, I know he did the right thing. And I'm happy to present this award to Dr. Sharan.
So at the end of the day, hard work and honesty pays off. And the combination of surgery, rehab and neurologics made the impossible possible. You can see the results in front of you.
My God, that's amazing. Neurologics, you said. Can you tell me a little more about it?
Well, now it's a full-fledged software. And in fact, that is the reason that PRS Neurosciences has such high patient count.
That's amazing. Can I see the software?
No. I'm sorry, but I can't show you that. It's top secret.
Oh, come on. Now, how will I be able to sleep at night without knowing that how did this miracle actually happen? I need to know. It's an important, thing to know.
Okay, I can explain it to you in the office. Will that work?
Done.
Let's go.
One second. You go. I need to take this. Yeah.
Okay.
Yeah, you proceed.
Yeah.
Hello? Yeah, I'm almost there. Just give me 1 hour. I'll get the software.
Take a look into my eyes and see the fire that burns slow.
Scene 63, 1 by 1.
Put your hands upon my face and promise me you'll never let go.
Scene 77, shot 1, take 1.
Falling down into the depths of my heart, touching my soul.
6 by 1.
I'm only half alive without you. You're the other half that makes me whole.
I knew it. Ladies and gentlemen, I was
Some have tried to tell me in this world there simply are no guarantees.
After all, Dr. Albert, MK. For such cases, rehab is very essential for recovery. It can take many months in such complex cases.
ओके ये हो गया इसके आगे
Rolling.
We're like a flame that always burns, like a city set on top of a hill.
Sharon is the first and only student of mine.
We've got love on fire. Come on, baby, let's show them we're
What's the first line? Huh. That's such a sick mentality. I mean,
यार मेरे नहीं है ना
Rolling.
74, 3 by 1.
And action.
Ladies and gentlemen, I was right.
so how did they manage?
क्या है
The receiver from of Retropolis is undergone DBS, not much useful. Came back. There's the hypertrophy of the sternocleidomastoid on both sides. कई बिट पिटी वाला
Close, open. Close, open. Close. ಕಾಲ್ ಮಟ್ಟಿ
ಕಾಲು ಫೋನ್ ಮಾಡಿ ಎರಡು ಕಾಲು ಫೋನ್ ಮಾಡಿ
ನೆಕ್ಸ್ಟ್ ಕಂಟ್ರೋಲ್ ಇದೆ ಅಂತ ಅನಿಸ್ತಾ ಇದೆಯಾ ನಿನಗೆ
ನೋಡಿಲ್ಲಿ ಆ ಕಡೆ ನೋಡು
ಅಲ್ಲಿ ಕೊಡು ಹೋಗಿ
ಊಟ ಮಾಡಿದ್ರಾ ಮಾಡಿದ್ರಾ ಏನು ಊಟ ಮಾಡಿದ್ರಿ ಅನ್ನ ಸಾಂಬಾರಾ
माता सीधा रखो.
ಓಕೆ ಟಾ ಟಾ ಟಾ
ಸ್ವಲ್ಪ ಸ್ವಲ್ಪ
पोजीशन सही करो
amazing. Nice. Great. Fast. 23, 24, 25, 26. Up. One, 2, 3, 4, 5, 6. Push, push. Very good. Slowly you do, okay? You can take 2 steps also, but do it very slowly. Yes, that's all. Done.
Option लेना बता.
You are requested to contact ground floor new building security immediately. Thank you.
Okay, done. Go. Slow, huh? Slow. Slowly.
When did you walk backward last? Where?
ನನ್ನ ಹೆಸರು ಮೋನಿಶ್. ನಾನು ಲಾಸ್ಟ್ ಇಯರ್ ಇಂಥ 1 ಇಯರ್ ಬ್ಯಾಕ್ ಡಿಗ್ರಿ ಮುಗಿಸಿರೋದು. ಓಕೆನಾ. ಸೊ ಮುಂಚೆ ನಾನು ಹೀಗಾಗಿದೆ ಯಾವಾಗ ಅಂದರೆ ಸೆಕೆಂಡ್ ಇಯರ್ PUCಲಾಗಿದ್ದು. ಹೇಗೆ ಅಂದರೆ ನಾನು ಬಾಲ್ಕನಿಲಿ ಓದ್ತಾ ಇದ್ವಿ, ಫ್ರೆಂಡ್ಸ್ ಎಲ್ಲ ಪ್ರಿಪ್ರೇಟರಿ ಎಕ್ಸಾಮ್ ಇತ್ತು, ಓದ್ತಾ ಇದ್ವಿ. ಆವಾಗ ಸ್ಲಿಪ್ಪಾಗಿ ಬಾಲ್ಕನಿಯಿಂದ ಕೆಳಗೆ ಬಿದ್ದಿದ್ದು. ಆ ಪಕ್ಕದಲ್ಲೇ ಮನೆ ಕಟ್ತಾ ಇದ್ದೆ, ಸೊ ರಾಡ್ ಇತ್ತು, ಅದು ಬೆನ್ನಿಗೆ ಚುಚ್ಕೊಂಡಿತ್ತು. ಸೊ ಅದನ್ನು ತೆಗಿಯೋಕ್ಕೆ ಆಪ್ರೇಷನ್ ಮಾಡಿದಾಗ ಆವಾಗ ಸ್ಪೈನಲ್ ಕಾರ್ಡ್ ಇಂಜುರಿ ಆಗಿತ್ತು ನನಗೆ. ಆಮೇಲೆ ನನಗಿದ್ದೊಬ್ಬರು ಫ್ರೆಂಡ್ ಒಬ್ಬರು ಹೇಳಿದ್ರು ಇಲ್ಲಿಗೆ ಬನ್ನಿ ಅಂತ. ಸೊ ಇಲ್ಲಿ ಬಂದಾಗ ಬಟ್ ಇಲ್ಲಿ ಅವಾಗ ಅಫೋರ್ಡ್ ಮಾಡೋಕ್ಕಾಗ್ತಾ ಇರಲಿಲ್ಲ. ಸೊ ಅವಾಗ ಫ್ರೀ ಥೆರಪಿ ಮಾಡಿಕೊಡ್ತಾಯಿದ್ರು ಮ್ಯಾಮು, ಶರಣ್ ಸರ್ ಗೊತ್ತಿರಲಿಲ್ಲ ನಾನು ಯಾರು ಅಂತಾಗ. ಮ್ಯಾಮ್ ಮಾತ್ರ ಕರೆದ್ಬಿಟ್ಟು ಕೊಟ್ಟಿದ್ದು. ಸೊ ಅವಾಗ ಫ್ರೀ ಥೆರಪಿ ಮಾಡ್ತಾಯಿದ್ದೆ. ಒಂದು 6 ಮಂತ್ಸಿಂದ ಬರ್ತಾಯಿದ್ದೆ ನಾನು ಆಗ. ಆಮೇಲೆ ಸ್ವಲ್ಪ ದಿನ ನಾನು ಎಕ್ಸಾಮ್ಸ್ ಇತ್ತು ಅಂದ್ಬಿಟ್ಟು ಬರ್ತಾ ಇರಲಿಲ್ಲ ಥೆರಪಿ ಮಾಡಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ. ಆಮೇಲೆ ಹಿಂಗೆ ಎಕ್ಸಾಮ್ ಎಲ್ಲ ಮುಗಿದಾದ್ಮೇಲೆ ಮ್ಯಾಮ್ ಹಿಂಗೆ ಕಾಲ್ ಮಾಡಿದರು, ಹಿಂಗೆ ಬಾ ನಾನೇ ಕೆಲಸ ಕೊಡ್ತೀನಿ ಬಂದು ಮಾಡುವಂತೆ ಅಂದ್ಬಿಟ್ಟು. ಸೊ ಅವಾಗಿಂದ ನಾನಿದ್ದೀನಿ. ಲಾಸ್ಟ್ ಇಯರ್ ಮಾರ್ಚ್ ಇಂದ ಜಾಯ್ನ್ ಆಗಿದ್ದು ನಾನು. ಸೊ ಇವಾಗಿಂದ 1 ಇಯರ್ ಆಯಿತು, 1.5 ಇಯರ್. ಏನಂದರೆ ಅಪ್ಪರ್ ಲಿಂಬ್ ಚೆನ್ನಾಗಿದೆ. ಅಪ್ಪರ್ ಲಿಂಬಿಂದ ಕೆಳಗೆ ಲೋಯರ್ ಲಿಂಬು ಬ್ಲಡ್ ಸರ್ಕ್ಯುಲೇಷನ್ ಆಗೋಲ್ಲ. ಸೊ ಏನಾಗಿದೆ, ಸ್ಪೈನಲ್ ಕಾರ್ಡ್ ಇಂಜುರಿನೂ ಆಗಿರೋದು, ಬ್ಲಡ್ ವೆಸಲ್ ಇದೆ, ಅದು ಕಟ್ಟಾಗಿದೆ ಅದು. ಸೊ ಅದರಿಂದ ಬ್ಲಡ್ ಸರ್ಕ್ಯುಲೇಷನ್ ಆಗೋಲ್ಲ ಲೆಗ್ಸ್ಗೆ. ಸೊ ಫ್ಲಿಕ್ಕರ್ ಮೂಮೆಂಟ್ಸ್ ಇದೆ, ಕ್ಯಾಲಿಪರ್ ಹಾಕ್ಕೊಂಡು ವಾಕ್ ಮಾಡ್ಬೋದು, ಆ ಥರ ಅಷ್ಟೇ. ಬಟ್ ಲಾಂಗ್ ಡಿಸ್ಟೆನ್ಸ್ ಏನಿಲ್ಲ, ವೀಲ್ ಚೇರಲ್ಲೇ. ಏನಿದೆ ಅಂದರೆ ನನ್ನ ಡೈಲಿ ಲಿವಿಂಗ್ ಹೇಗೆ ಚೇಂಜ್ ಮಾಡ್ತು ಅಂತ ಸರ್. ಯಾಕಂದರೆ ಮುಂಚೆ ಎಲ್ಲ ಮನೇಲೇ ಯಾರು ಸಪೋರ್ಟೇ ಬೇಕಾಗಿತ್ತು, ಹಾಗಿರ್ತಿತ್ತು. ಈಗ ನಾನೇ ನನ್ನ ಕೆಲಸ ಹೇಗೆ ಮಾಡ್ಕೋಬೋದು, ಹೇಗೆ ಶಿಫ್ಟ್ ಮಾಡ್ಕೋಬೋದು, ಯಾರ್ದು ತೊಂದರೆ ಇಲ್ಲದೆ ಹೇಗೆ ನಾವೇ ಕೆಲಸ ಮಾಡ್ಕೋಬೋದು, ಎಲ್ಲ ಟೆಕ್ನಿಕ್ಸ್ ಕಲಿಸಿದ್ದು PRS ನ್ಯೂರೋ ಸೈನ್ಸ್. ರಿಯಾಬ್ ಅಂದರೆ ಜಸ್ಟ್ ಫಿಸಿಯೋಥೆರಪಿ ಅಂದ್ಕೊಂಡಿದ್ದಾರೆ, ಆ ಥರನೇ ಅಲ್ಲ. ಈಗ ನಮ್ಗೆ ಬೇರೆ ಟೆಕ್ನಿಕ್ಸ್ ಇರುತ್ತೆ, ಇವಾಗ ಮಾಡೋಕ್ಕಾಗದೇ ಇರೋ ಮಾಡ್ಬೋದು, ಬರೀ ಟೆಕ್ನಿಕ್ಸ್ ಕಲಿಸ್ಕೊಡೋದು ಇಲ್ಲಿ ಕೆಲಸ. ಇಲ್ಲಿ ನಾನು ಫ್ರೆಂಡ್ ಡೆಸ್ಕ್ ಅಸಿಸ್ಟೆಂಟ್ ನಾನು. ಸೊ ಕಾಲ್ಸ್ ವೆಬ್ಸೈಟಿಂದ ಕಾಲ್ಸ್ ಬರುತ್ತೆ. ಸೊ ಯಾರೇ ಎನ್ಕ್ವೈರಿ ಮಾಡಿದ್ರು ಫಸ್ಟ್ ನನಗೆ ಬರೋದು. ಸೊ ನಾನು ಕಾಲ್ ಎಂಟ್ರಿ ಮಾಡಿಬಿಟ್ಟು ಅವ್ರನ್ನ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಕೊಡೋದು, ಇಲ್ಲ ರಿಹ್ಯಾಬಿಗೆ ಕರೆಯೋದು, ಇಲ್ಲ ಇನ್ಪೇಷೆಂಟ್ ಇದ್ದರೆ ಅವ್ರ ಫೆಸಿಲಿಟಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ ನೆಕ್ಸ್ಟ್ ಅವ್ರು ಶಿಫ್ಟ್ ಆಗ್ತಾರೆ ಅಂದರೆ ಪೇಷಂಟ್ ಈಗ ಬೇರೆ ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ಇರ್ತಾರೆ, ಅಪೋಲೋ ಹಾಸ್ಪಿಟಲ್ಲು, ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್, ಅಲ್ಲಿಂದ ಎನ್ಕ್ವೈರಿ ಬರುತ್ತಲ್ಲ, ಸೊ ಅವ್ರನ್ನ ಶಿಫ್ಟ್ ಮಾಡಿಸೋದಕ್ಕೆ ಹೆಲ್ಪ್ ಮಾಡೋದು.
जाओ